My name is Timothy Jones, and I'm a consultant neurosurgeon. So I first became interested in neurosurgery when I was a junior doctor, and I was looking after a very poorly patient who was drowsy and unable to move one side of their body. And after having a scan, we realised that actually they had something that could be treated with surgery. I did this operation with the supervision of a senior consultant, and almost on waking up instantaneously, they were back to near normal. And I was taken aback by how dramatic the improvement was. And I realized that doing this job allowed me to do this type of surgery and to actually make people's lives better every single day. The brain and the central nervous system is one of the most complex parts of the human body. And it's fascinating to work in day by day. And it's fascinating to look after patients who are often very scared and going through a very difficult period in their life. And it's a real honor and a real privilege to do my job. I think the most rewarding aspect of my job is looking after patients who are really scared and worried about what could be going on, and nurturing them and looking after them through this period, so giving them a diagnosis and treating them and making them better. So it's essentially a great way, a rewarding way, to taking someone who's really at a difficult time in their life and making their life dramatically better. And also, you get to look after them sometimes for many years and get to know them and their family very well. And that's really what I aspire to as a doctor, is to get to know my patients and really give them personalised care. Well, at your first appointment, it'll be an opportunity for us to discuss your story and how you've come to need to see me on that day. We'd also need to, in some cases, examine certain aspects of your nervous system to see if there are any signs that you have any impacts from your condition on your body. We'd likely then need to either arrange some scans, or you may have had some scans done already, in which case we can look through those together. And we can then make a decision about the next steps. Sometimes, if your case is complex, or for instance, is involving the management of a brain tumour, I may need to review your scans and your story with my team in a multidisciplinary team meeting to make sure that we agree as a group that the treatment that I'm going to offer you is the right thing for you. We then may have another appointment to discuss what that operation would involve and to go through the process of getting your consent and approval to go ahead with that. And then we'd go ahead and make the arrangements for that treatment going forward.